So I hope that this is a bit more of a relaxing talk and you can just enjoy it, not too taxing. So my background's in pediatric and public health. I've worked as a clinician in this country and abroad, and mainly delivering health systems for the last 20 years, really, in the UK and in low-middle income countries. So with that, I think I'm going to be short of time, so I hope I don't run out of time. I'm going to speed through this. This is the summary of what I'm going to share with you. Initially, a kind of a broad overview of the range of ways water affects health, and then look at the global priorities that we all have in addressing some of the challenges that go with that, and then share with you my Gambian recent pieces of work that may be somehow relevant to some of you, I don't know. So these are the broad headings under which one could say water affects health. Drinking water, water hygiene, water for industrial use, water for food security, waterborne diseases, waterborne vectors and disease transmission, communication, contamination of water and its effect on health, and finally water as an agent and cause of disasters. So I'll be going through these very briefly, and I'm not an expert in quite a few of these, but had some experience in most of them. I just think it's important that we review a range of ways water can actually affect health. So all of this theory and various work that you're doing, maybe you can relate to everyday experience of many millions of people in the world. So drinking water, obviously as organisms we can't escape the fact that we all need water to survive. However, if the water is not clean and it's somehow hazardous, it's not safe, then it causes deaths, as it does every day. Thousands and millions of people die of diarrhea and pneumonia, both of which are related to hygiene and sanitation. So if we can somehow manage better our waters and our drinking waters and other waters that we use, we can prevent millions of lives actually on a weekly basis probably. There is other aspects of drinking water, not just bacterial contamination, and those are probably some of you have heard of the arsenic mitigation programs in Bangladesh, where it's not and the tube wells, I suppose this is contamination in the, it's not even contamination, it's substances in the soil that somehow are seeping through but can cause illness and ill health. So going back again to the idea of availability of clean water, it's been estimated by the United Nations that nearly 200 million hours a day is spent by people collecting water. And most of those are children and women who therefore can't study and spend that time doing other things. So this has great social implications. Water is also used quite clearly at the household level for other purposes. Washing our hands and bathing are very important practices, without which also we can get disease and die. Food cleaning, domestic cleaning, food for toilets, water for use in toilets to make sure that they are clean and hygienic, and I'll come to that in a minute. And home gardening is a very important, we have allotments in the UK, but in developing in low-middle income countries, there's been a few decades of program encouraging households to have their own gardens, and if there isn't enough water for this, or in fact it's contaminated water, what can happen is that the reason for these home gardens are diversification of food, so that malnutrition and these other consequences of very unvaried food can be prevented. However, if this garden-grown food is contaminated, clearly that's a big issue. In England and many high-income countries, we take water for granted. It comes out of a tap. However, our little lady down there has probably gone a few miles to collect that bit of water with which she's washing her hands. So open defecation, sadly, is still a problem. Apparently 1 in 7 people in the world open defecate and have no access to proper sanitation and toilets. And so this can be actually in one's own backyard, or in some other places, as you see in a couple of these photos, or if there are some kind of latrines available. As you see in that cartoon, quite frequently children actually can't use them. The hole is, it's too wide, or somehow unsafe, or what have you. So actually, you still have open defecation and problems that go with that. This picture on this one, on your right bottom corner, is one I took myself in Afghanistan. So there are streets like this where, for all intents and purposes, the houses actually do have toilets. However, the material and the hole, if you like, is not deep enough, and nobody comes to collect it. And these holes are where the material comes out in the street, where these poor fellows have to walk. Well, you yourself, oneself has to walk. I went down this lane to get some roses for our garden, and ended up throwing my shoes away. But people live in these circumstances. This is not rainwater. Okay, so of course these circumstances are all made worse. I mean, domestic availability of water, whether it's for drinking or otherwise, is made worse by shelter and poverty. So we're very familiar at the moment with the issue of various refugees and these temporary home environments, and there are many of these in the world, or people who are living in environments where they have to survive droughts or so on. But also there is a lot of homelessness and literal poverty in our own communities. So there's the figures for the UK, and these people who are homeless have no access to running water or water to clean themselves and so on. So another related area, of course, a lot of industry needs water to actually be able to function, but quite a few of them relate to actually aspects that affect our health. So if they're producing water or drinks for us, they have to keep their sites hygienic for their staff's sake, and also for the things they produce that we may be consuming. So the other angle of this is, of course, that they pollute our waters quite badly. Food security is a very important aspect of health and a cause of malnutrition and death in many low middle income countries. And of course you need water for agriculture as well as livestock and fishing. What actually I wanted to highlight there is that in children it's not just starvation that affects them, but it does affect the actual growth and development of the child, which means the next generation is affected and they will not be achieving their potential. So another angle of water and how it affects health is that water itself is actually an agent for transmission of disease. So we talked a bit about the effect of diarrhea, but actually diarrhea spreads through water as a main agent. So microbacteria such as cholera, typhoid, dysentery agents spread through water. So, the picture down here is 1970s Bangladesh, where thousands of people died of cholera. In the current days in our own society, by going swimming in a dirty pool, or just, eating in the wrong place, or indeed not washing your hands, one can have diarrhea, and it can, even in high-income countries, it's a cause of a lot of days off work and discomfort. It's quite painful and can have long-term consequences. Water is also an agent for vector-borne diseases. So vector-borne, these vectors, as you know, are animals, if you like, that carry diseases. So the commonest you would know about is malaria and dengue fever. These are transmitted through mosquitoes. This is the mosquito for malaria, and that one for dengue fever. And so, clearly, that one can die from these conditions, and they are also the cause of a huge loss of human potential, really. Something a bit more human-caused are other ways of contamination of water that affect our health. So a very topical area at the moment is the cause of antibiotic-resistant bacteria. So as you know, overprescription of antibiotics, whether it's for animals or for human consumption, can increase resistance in bacteria. And this bacteria gets into the environment, into the soil through defecation or whatever various ways. And the cycle continues, so that basically through the water and the agricultural work that we have, or even the animal food that we end up consuming, this antibiotic-resistant bacteria spreads. And currently, certainly in low-middle-income countries and even in high-income countries, this is, you could say, out of control. And quite a big danger, actually, to our healthcare, because quite a lot of these bacteria cannot be treated by any antibiotics that we have, or they're actually very expensive, very rare antibiotics. You wouldn't want to use them, because if they become resistant to those, then really we have no way of curing some of these conditions. Sorry. So another topical area are microplastics. So if you've watched Blue Planet, you'll be familiar with pictures like that, that big one down there. This poor fish is consuming our waste plastic. And as you can see, this is a water flea. So there's a lot of smaller marine organisms that are then consumed by fish or what have you. So this goes all through our food chain. And of course, there's now a flurry of research on what these do to us and how they affect our hormones and biology. Then something a bit more down to earth, perhaps closer to home for you colleagues here, is water as an agent of disaster, really. And so in the news in the last few years, you've heard a lot about cyclones and typhoons and how they have destroyed a lot of lives and communities and so on. What we don't hear a lot about are everyday floods. You would know a lot more about them, probably you know the numbers, the statistics I don't have. But I mean, there are thousands of smaller floods that happen to communities that destroy actually those communities on a daily basis, that don't even get into the local news, never mind international news. So this is my personal experience in Afghanistan again when I was working there. This is Tajikistan, actually, the Tajik border, I should say. It's Afghanistan, but Tajik border. So the Badakhshan area. And the top picture is every spring, you know, these are huge mountains, a lot of snowfall, and when there is a huge spring rain drop, the snow melts with the rain. You have these landslides, huge boulders that destroy homes. Homes are very flimsy. They also cover farmyards, so people's livelihood is gone, people's homes and lives often gone. They also don't have very good health services, so if you are injured, you're done really. Then the one at the bottom is a similar kind of geographical area. However, this is a plain sort of part of the region, I should say. And this is a common occurrence every spring. Basically, this is normally a stream, maybe narrower than this tube here. But when spring arrives, this is what you get, and you can't pass you can't pass them really. There are no bridges or any other way. So for us to get resources to our clinics, which were this side of the river, this is what we had to do, and sometimes we actually couldn't cross. So that meant patients couldn't be brought through ambulances, it meant we couldn't get supplies to the facilities, and sometimes staff couldn't be transported there. So clearly no services then. This picture represents another area in Afghanistan. New clinics just been built for communities, never had a clinic before. And first rainfall in the spring, they had a flood. So this is our pharmacist who's knee deep in mud and is trying to rescue his drugs there, and the clinic had to be shut for a week. So if you're in labor or somehow in danger, I'm afraid no facility for you. So you would be far more familiar with this Sustainable Development Goals than me, I'm sure. As you know, this development really, I would say, is a kind of a historic development in our times. I think in human civilization, we haven't had a period where governments of the world have come together and tried to resolve their problems together. So the last, 30 years where we've had these summits, I think really we should feel ourselves very lucky to live in this time and to have a part in it. So it's exciting at the same time as perhaps depressing looking at some of those goals. So as you know, it started with Millennium Development Goals. Millennium Development Goals were more limited, only for LMIC, and trying to address the problems of the poorest of the poor. Whereas the SDGs, the Sustainable Development Goals, are for everybody. They're supposed to leave no one behind, and everybody should have a role in them. So please find your role in them. I'm sure you have it, but announce it to everyone, because most of my friends at home haven't heard of these SDGs or MDGs. So please do talk to your neighbors and friends, and I think everybody can feel a part of this in some way, even if they're just recycling their rubbish. So I would like to focus on just 3 of these as a way of trying to address some of those human problems that I've been going through. Clearly, every one of these in some way relates to somehow water in some way, and also to health in some way. but we don't have all day, so I'd like to concentrate on SDG 3, 6, and a little bit on 14. And 13 is mainly about the climate change and the way it relates to health, I suppose, is management of disasters and preparedness. So, very quickly, how does it relate to water and health and these SDGs? The number 3 is the obvious one, good health and well-being for all people, for all ages. So whatever age you are, your health should be improving or addressed. So every SDG has various targets, and these 2 targets that I've circled of this SDG 3 are particularly related to water. I thought, as I say, quite a few of them relate anyway. So if you look at target 3.3, you see malaria in there. And you also see to combat waterborne and other communicable diseases, which we've discussed. So if you look at 3.9, you look at reduction of death and illnesses from hazardous chemical and air, water and soil pollution, which again we've discussed. And by the way, I'm sure you're already using these, but if you're not using these SDGs in your grant applications, it does help, I think. So then clean water and sanitation is the one I'm going to give you an example of. This is about ensuring available and sustainable management of water and sanitation for all. And again, it has many targets, but the 3 targets I'd like to talk about, and I have already talked about, safe drinking water, and sanitation and hygiene. We've talked about some of those figures. And I think your work probably is very pertinent to 6.5. If you read the comment at the bottom, it says access to water poses the biggest social, societal and economic risk over the next 10 years. So please, colleagues in geography, how can we access our waters better and manage them better? So life below water, we also touched on this, the fact that we want to improve the situation with marine pollution and also overfishing, which reduces fishing as a source of food, which is, of course, very important for many, many populations in the world, the island populations and so on. So I don't know if I have enough time, another 5 minutes, to give you an example of a piece of work that we're doing in public health and with some colleagues internationally and nationally. Maybe if you're interested in this area of work, please come and talk to me, or any area of work actually to do with public health and water. So we talked earlier about hygiene and sanitation and importance of clean water to drink, but also clean food to eat is, of course, very important. And eating clean food is related to how how hygienically you prepare it and how hygienically you consume it. So in here, we're focusing mainly on weaning children or children at the age of complementary feeding, which is usually, it should be 6 months to about 3 years. However, often people start giving alternative to breast milk very early in our country and low middle income countries. So whenever the mother starts giving other than breast milk, this is what we are concerned about until they come to eat the family food. So usually, as I say, it's about 4 months, 6 months to 2.5, 3 years. So in low middle income countries, believe it or not, until recently, in fact, until our group and our colleagues in London School started just a few years ago, nobody's been looking at this. It seems very obvious, eating food. If babies are eating, contaminated food, they get sick, but no one's looked into it very much as an intervention. So the focus in water and sanitation wash field has been mainly on clean water to drink for the family, and also in latrines and general hand washing, as opposed to specific focus on food and water for the infant. So this project was to develop and evaluate a community intervention for weaning food and water preparation and handling practices in rural Gambia, as an example of a country. So diarrhea and pneumonia, I think I referred to these earlier. Pneumonia as well, even though it's a respiratory disease. I mean, you know when you have a cold, you go and wash your hands so that you don't transmit it to others. It's the same kind of principle. Diarrhea and pneumonia have been both linked to improved hygiene. And also they are by far the biggest causes of death in children under 5. So globally, including in our own country, but particularly in low middle income countries. The other big cause is prematurity and those kind of issues that go with very young babies. So annually, millions of babies and children catch diarrhea and pneumonia and die from it. So this is a very important priority globally. In MDGs, there were 2 targets given to these. In SDGs, there's 3.2, that is reduction of childhood mortality, which is death. And that to tackle that, you really have to tackle the 2 big causes, which are these 2. So for our project, we were, as I say, trying to improve the way the mother prepares the food and the water for the weaning child. And we used three approaches, or say theoretical models, which I'll try to very quickly describe. So the first one is hazard analysis critical control points. So again, you're probably more familiar with it than me. This is used in industry when processes occur. You're trying to find where things can go wrong, and then you develop some corrective measures, things you should do to prevent that thing going wrong, so that your car or your can of food or whatever is high quality. So WHO recommends, World Health Organization recommends that this should be used in household practices to identify what communities are doing wrong so they can prepare the food more hygienically. Again, this is almost a new area. They've talked about this for 10 years and nobody's done anything much in this field. So we use this technique. Basically, you observe the communities and mothers and and you come up with your critical control points during the food preparation process and the corrective measures. So these are the corrective measures we came up with. They're not rocket science, but 1 or 2 of them are quite specific to communities. So for example, this one, something about how you dry your food, your crockery and things, the pots and pans. So in Gambia, people would leave it on the floor or on a dirty wooden surface. In Nepal, where a colleague did a pilot, their kitchen was part of the house, and everybody came and went, and it wasn't clean. So one of their critical control points was to demarcate the kitchen so you can keep it clean. And so it could be a little variations on the theme, but on the whole, it involves hand washing of some description and washing things, and always soap. And in terms of water and milk, usually it will be boiling it. Now, the issue is that we know a lot of things to do as human beings, and we know that they may be bad for us. But just knowing that they're bad for us and they cause disease doesn't seem to be a motivator for behavior change. So if you think about our own situation here, we know fatty, salty food is not good for us, but we all eat crisps and we love fish and chips and lots of other things, and we know they're bad for us until we have a heart attack or something that the doctor tells us will die, until we change our diet. So that's a good motivated death. But disease, the prospect of disease is not a good motivator. In this country, for water sanitation, we all have nice toilets and hand washing basins and soap and everything. But as you know, there's a lot of research that people come out of bathrooms, and public bathrooms even, and don't wash their hands, whatever reasons. So we observe these communities, and this is not the only community where this has been observed. And mothers actually know exactly what to do. They know they have to wash their hands with soap, when they have to do it, how it affects the child in terms of diarrhea. But when you actually sit and observe them, like throughout the day, they don't do it. So we observed 30 mothers initially for our little pilot. Out of 30 mothers, all of whom knew they had to wash their hands with soap and water, 3 of them washed with soap when they were observed throughout the day. So that's many occasions where they could be washing their hands in preparation of food for the child. So that's very interesting. So there is this new, it's not terribly new, but this one method, which seems to be, I think, anyway, more effective than the other methods that have been tried, and that is a sort of it's called eco-psychological model to identify motivational drivers for behavior change. So what is it that will motivate you to change your behavior? So a young teenager, many of my son's friends, where I hear from their parents, and I'm afraid it's the same for my son. You know, when he goes to the bathroom, you know, he spends sometimes an hour in there with his phone, playing his game with his mates, and he comes out without washing his hands. Why is that? Because he wants to win the game. He's not worried about having diarrhea. So his motivation is his game. Okay, so that is his motivation. So if I can somehow affect that, which I can't, I can change his behavior. So in terms of these mothers, again, you do studies with them, and you work out what is it that motivates them. So it could be, for example, status. Ensure hands are clean to be respected by others in the community. You know, oh, this is a clean mother, I love her food, I know she's clean. The husband will see my hands as nice, smelly, and they think, oh, I'm a nice wife, and he will love me more. God will love me because God loves somebody who's clean, or that the fact that I nurture my child, and he will grow up to be a well-respected person, earn some money, and come back and say, "Thank you, Mom, it was because of you I got where I am." Not the diarrhea, note here, yeah? That is what may motivate her. So they're slightly different, but they are the same thing, if that makes sense. So the disease model doesn't necessarily work. It's the social model that works. So then, with all that, goes, well, how do you do that then? How do you use the motivational drivers and these critical control points to bring about change? So then there are various things to do, various ways of doing it. What we tried was what's called community mobilization, where you get everybody going in the community, not just the mother, to encourage the mother to do the right thing, to encourage her. You do competitions, you make her feel good and important, and also you used acceptable ways in that community, like performing arts, songs, drama, stories, that relate to those people. So that they can connect with it. It becomes real and it's fun, It's not all about death and dying and going to hospital with diarrhea. So in Africa, you will know that there are traditional communicators who drum messages traditionally. So traditionally, between the tribes or communities, they would drum, there's a meeting going on, or this person's going there and that. So these exist actually, it's still already in the communities, and for illiterate communities, this is the way to communicate. So we engaged these traditional communicators to help us do drama and songs and all sorts of happy, jolly things, and have basically a campaign that would get our message across. And the songs can be learned by children, by mothers, people sing them, they don't forget the messages. And also competitions is a status issue that I mentioned to you before, so mothers had to reach certain levels of behavior change and be observed to do it and be telling other people, and then they become Ma champion. So the Ma champions get those badges you see around their neck. And the village, if it achieves a certain number of Ma champions, then gets a label at the front of the village with the certificate to the head of the village, and so on. So that's all community mobilization. So we wanted to evaluate, actually, is this doing anything? Sounds great, but what's happening there? So in medicine, the highest level of, I suppose, evidence for effectiveness of an intervention is a randomized controlled trial. In this kind of intervention, you randomize at the village level, not individual level. So randomized controlled trial is, I'm sure you all know, but just for one person who may not, you select your participants, whether they're individuals or villages or schools or universities, what have you, and you randomly allocate them to control, means they get nothing, or some alternative that is very different. And then the others get your intervention, again, all randomly selected and appointed. And then you observe certain outcomes which should be measurable and, certain standards and so on. So I'm afraid I don't have time to go through all the details, but we did this across 30 villages in Central River region of Gambia. So the villages were randomized, and you do a sample size and all that. This was the poorest part of Gambia with diarrhea and pneumonia at the highest rate in the country. Please don't worry about all the numbers and readings, but I just thought it's good to give you a proper table. So this one is our health outcomes, which actually was secondary outcomes. So in medicine, at least, secondary outcomes are not seen as very important. I don't personally know why, but I'm not a statistician. But health outcomes, we didn't think will have any impact on health outcomes just by measuring 30 villages. And we were absolutely astounded at the result that we found. This is reported disease. Okay, so that means the mother said, my child had this or that over the last 7 days. So it's not doctors saying it, but nevertheless, that is quite a good outcome. So mother had reported that in the last 7 days, and you see the control is the first column, intervention is the second column, we had nearly half the respiratory diseases reported by the mother, nearly by a third the diarrhea reported, and nearly, over a half of actually admissions. So admissions is a more certain thing. Yeah, if you're not sure your child had diarrhea or not, maybe, but if your child's been to hospital. Numbers are not very high for the admission, but very interesting anyway, and this is the statistical tests for it. So, and we did also observe the mothers, so this was our primary outcome, to see if they would change their behavior. We thought that's the only thing we could observe. So that's what we sample size for, but as I said, we were surprised. So here, this is all the different activities we asked them to do, and the top one is a composite of all the activities, of 5 activities, not the water. Water is at the bottom, drinking water was one of them. You can see in the control community, 0.4% boiled the water, or did anything with it that treated it, and the others were 86%. This is quite an incredible change. I should tell you that this table also, I personally don't know any other community intervention that has brought about this level of change. If this is real, this is the only study. If this is real, I don't know why we're doing anything else really. We should do this first. But we're looking for funding if you know anybody interested to do another study. So anyway, this is our behavior change. And you can see quite a number of behaviors are like from single figures to very high percents of change. And we also did some lab testing of the food and the water. And again, this is a log coliform, can coliform being the main thing you worry about, which is from feces and soil. And so you can see again, there is a huge statistical difference between the groups. So I'd just like to thank all my colleagues that participated in this study across London School of Hygiene and Gambian government. And this was a PhD work, actually, a humble PhD work, which has come quite a long way. So the gentleman's now in Gambia, and our funders, really. Thank you very much.